KP Video News in the Funk Groove.
That's right. It's time for KP Video News. And here's a story that I've been going back and forth with here over the past couple of months, since this whole coronavirus situation jumped into the picture. And it had to do with, this one is about institutions, and here's a story that I discovered. It says prisons are the new petri dishes. Don Siegelman says social distancing in prison is impossible. In the United States, the largest known concentration of coronavirus cases outside of hospitals is not on a cruise ship or in a nursing home. It's in a Chicago jail. Prisons and jails have become petri dishes for COVID-19. Former Alabama Governor Don Siegelman spent 5 years in prison after being convicted on federal charges of bribery involving a campaign contribution. He says social distancing behind bars is not difficult, it's impossible. It's impossible for men living under those conditions to social distance. Inmates share showers, use common communal soap, and relieve themselves in bathrooms where the urinals are no more than inches apart. There is no separation, said Siegelman. He continues, if there's any kind of disease or infection or virus, it's going to spread. According to the Marshall Project, a non-profit organization tracking the spread of COVID-19 in prisons, there are more than 9,000 confirmed cases of COVID-19 among prisoners and prison staff in the United States. More than 140 of people, most of them incarcerated, have died. So that's 140 have passed away. Since March 26, 2020, the number of new cases among prisoners has doubled each week, more than doubled each week, showing that the curve used to measure when the virus is under control is still soaring in prisons, even as some parts of the country are starting to see a curve flatten. The number of new cases grew by threefold in just 7 days. 6,684 new cases were reported during the week of April 15th, 2020. Siegelman says the numbers are far greater than those released by the Federal Bureau of Prisons. Think about it. If we haven't tested people in essential services in our own community, you can bet they haven't tested inmates. These starting statistics are undoubtedly an undercount. While most prison systems in the United States are releasing data regarding the number of positive tests and prisoner deaths, the vast majority of them remain tight-lipped about testing. The Marshall Project reports that 16 prison systems are not releasing information on the number of prisoners being tested, including the Federal Bureau of Prisons, which has seen several major outbreaks in its institutions. Governor Siegelman says chronic overcrowding is the main cause of the multiplication. Numbers back Siegelman's story. According to the U.S. Department of Justice in the United States, the size of the inmate population in the federal prison is 20% over capacity. Siegelman says when he served his time at Oakdale Prison in Louisiana, more than 175 inmates were cramped into a facility built for 80 people. During this tenure at Oakdale, Siegelman spent time in what's known as Oakdale as the 21 room. It was like being in a crew quarters of a submarine. There was one door in, one door out, no window, and one small fan in the corner that could only make matters worse. 21 men slept in 5 rows of bunk beds, stacked 3 high. I had the middle bunk. There wasn't even enough room to sit up, Siegelman said. And he says 17,000. He says 17,000 is a start, but that's just a start. He says the biggest hurdle is permeating in the mindset of a country which has been raised on ignorant, lock 'em up and throw away the key mentality. We have to change our sentencing law. We have to release people from prison who are nonviolent and who do not pose a threat to society. We can put them on home confinement, or better yet, place them in a position where they can do some good for the public. Said the pandemic has exposed the problems we have in prisons to be public. I'm hopeful that just as COVID-19 and the quarantine is leading to changes in our economy, changing the way we do business and creating new opportunities to earn a living, it will open the eyes and lead to criminal justice reform. He concludes by saying, one would hope this pandemic will wake people up. If an inmate is nonviolent and does not pose a threat to society, why is he or she in prison? And so that's a good question. That is a real good question, especially at this time and date when you have people that have committed violent crimes. You know, hey, if you're gonna, those are the ones that need to be behind bars. But if you just went to jail because you had a traffic warrant, and now you caught up in a system like in Chicago county jail system, and not only that, the courts are closed, so you don't know when you're going to be able to go appear before a judge. And here's a disturbing situation: is part 2. All but one coronavirus death in Virginia's capital have been black Americans. The county health director isn't surprised. Danny Avila, the director of health districts in Richmond, Virginia, told Insider that 13 of the 14 people that died from the COVID-19 in Richmond are black. Richmond has had 312 COVID cases, 60 hospitalizations, and 14 deaths. White patients account for just 21% of COVID patients, while black patients account for 58.3%. Avila said the disproportionate higher death rate in black communities is tied to decades and centuries of structural inequality and inequity. Almost all of the people that died from COVID-19 in Richmond, Virginia are black Americans, according to Danny Avila, the director of Henrico Health Districts. Avila told Insider that black residents account for 13 of the city's 14 COVID-19 deaths. The statistics shows that COVID-19 deaths are disproportionately affecting black communities. And in Richmond, where the population is around 228,000, 45% of its residents are white, 47% are black, and 6.7% are Hispanic. The fact that more African Americans in the city are dying of this, that's nothing new. That's specific to COVID-19. That's a revelation of the underlying inequalities and inequities that we have always dealt with. And this is just one more thing that's bringing that to the forefront. It's rooted in decades and centuries of structural inequity. Virginia as a whole has 14,339 cases, 492 deaths from the virus. Richmond alone has had 312 cases. So racial minorities are being hit harder by COVID-19. Across the United States, the Center for Disease, the CDC, and has found that racial minorities have been disproportionately impacted by COVID-19. That's because the CDC said racial minorities are more likely to live in densely populated areas and multi-generational households and make up a disproportionate number of the county's incarcerated or the country's incarcerated population, all factors that hinder social distancing. The agency also said that many racial minorities work at essential businesses, don't have access to paid leave or paid sick leave, and underlying health conditions. The reality is black Americans are disproportionately in lower socioeconomic strata and therefore have higher exposure based on the jobs they have to work and that they're relying on public transportation, Avila said, adding that many of Richmond's black residents work in healthcare institutions and at essential businesses. Experts have said that black communities on average are in worse health than other groups. Studies have also found that black people might be less likely to seek medical help because of a distrust in the American health system, which has a history marked with racist experiments, including one in Tuskegee, which over 400 men were part of a syphilis study without their knowledge. In